Back. Hi there, my name is Anna. I'm going to be your nurse. How are you doing today? Good, okay. I'm going to just start by providing us with some privacy. Do some hand hygiene. And I have all my necessary equipment for today. I'm going to be doing a head, ears, eyes, nose, and neck assessment on you today. This is going to require me to touch you a little bit. Does that sound okay with you? Okay, great. So just to get started, I'm going to look at your ID band. And I'm going to have you confirm with me your name and date of birth.
Ali Patel is July 26, 2002.
Great. I'm just going to start by asking you a couple questions. Can you tell me what month it is?
January.
Yes. And where are we today?
The hospital
And why are we here?
for a checkup.
Great. Okay, so patient is alert and oriented times 4, meaning she knows person, place, time, and situation. Do you have any allergies I need to be made aware of?
No.
Okay. And on a scale from 0 to 10, 10 being the worst, can you describe your pain for me today?
0.
0? Okay, awesome. So first thing I'm going to do is I'm going to inspect your head and facial region. I'm looking for size, shapes, symmetry, and position. Overall, your posture looks good. Then I also wanted to mention you have good hygiene. You look like you are dressed appropriately for the weather, and that you're the age that you stated, and no emergent issues that I would need to address before continuing my examination. But going back, I'm looking for size, shape, position, and symmetry of your head and facial regions. I'm just going to kind of look around and inspect first. And your eyes are set equally with each other. Your nose and mouth are at the midline. Your brows are also set equal. Have you pull back your hair real quick. Your ears are also set at the same place. So everything looks good and symmetrical in the proper shape. So I'm going to go ahead and start palpating your head and face, okay? Okay. Everything feels really symmetrical. I'm not feeling any abnormalities, no bumps, lumps, lesions, anything like that. I'm going to feel your frontal sinus. Great. Can you tell me if you're feeling any pain or anything when I'm doing this, okay? No tenderness. Maxillary sinuses. Great. Okay, next I'm going to look and inspect your neck. I'm looking for any abnormalities, bumps, and then I'm going to also palpate your neck as well. Let me know if any of this is tender or painful for you. I don't feel anything abnormal. Everything feels very symmetrical. I'm also going to feel your thyroid. I'm looking for enlargement or any bumps of the thyroid, which I don't feel. It feels normal. I'm going to have you do a range of motion test for me real quick. So I'm going to have you take your chin and bring it to your chest. Great. And then bring your chin all the way up to the ceiling. Yes. And have you turn all the way to the left. And then all the way to the right. And I'll have you bring your left ear down to your left shoulder. And your right ear to your right shoulder. Great. All of that looks really great. So next thing I'm going to do is I'm going to inspect your eyes. So what I'm going to first do is I'm going to have you pull down actually your eyes right here for me, just like this. Great, and look up. Okay, I'm just looking at your conjunctiva, which is pink, which looks good. And then just kind of look around for me a little bit with your eyes. Your sclera looks nice and white, so no indication of any yellowing or jaundice or anything like that. So next thing I'm going to do is I'm going to test your pupil's reactivity to light. So you're just going to look straight up at me. So pupils are equal, round, and reactive to light. Your pupils are at about a 3 millimeter, and 3 to 5 is normal, so those are within range. So it looks really good. And then next I'm going to do an accommodation test. So what I'm going to do is I'm going to hold my pen light over here. You're just going to look at my pen light, and I'm going to bring it close to your face. You're not going to move your head. You're just going to stare at the pen. Great. Patient has good accommodation. Next thing I'm going to do is I'm going to check your nose. I'm just going to palpate first. And nose is symmetrical as well. I'm going to have you look up a little bit for me. I'm going to look inside the nose. I don't see any discharge, any foreign objects, any abnormalities with the nose. Next, I'm going to inspect your mouth. Just outwardly, your lips are pink. They have defined borders. Nothing abnormal, no lesions, anything like that. So next, I'm going to have you open your mouth. Great. And I'm looking inside. I'm looking at the buccal mucosa. Can you stick your tongue out for me? Tongue looks pink and moist. Move your tongue around a little bit for me. Great. I'm looking at your hard and soft palate, which are also pink and moist. Your uvula is intact, along with your tonsils, which do not look swollen. And then smile for me. Patient has white and intact teeth, which is good. I'm also going to have you do a patency test. So I'm going to have you, this is for the nose, so I'm going to have you take one of your fingers and close, yep, and then maybe breathe in and out through that open nostril. Great, and maybe do the same on the other side. Great, patient doesn't have any congestion. congestion or any blocked sinuses. That's good. Next, I'm gonna look at your ears. I'm inspecting, I'm gonna look inside, make sure there's no buildup of cerumeum. And then your auricle also looks good, symmetrical. I'm gonna palpate a little bit. You tell me if you have any pain. And then your external auditory meatus looks good. I'll come on the other side and do the same thing. Okay, I'm still gonna palpate. And again, no discharge, no foreign objects. Everything looks symmetrical and normal. So next I'm gonna do whisper tests on you. So I'm gonna stand about an arm's length away from you. And I'm gonna have you cover the opposite ear of where I'm standing, so this ear. And then I'm gonna whisper a few words to you, and I'm just gonna have you recite them for me, okay?
5, 7, 5, 7, 9.
Great. I'm gonna come on the other side and do the same thing.
4, 8, 4, 2.
Great. Okay. Overall, patient looks really good. I'm gonna document any of my findings. So we're all set for today, okay?